Hey everyone, and welcome to this explainer. Today we're diving into an absolute masterclass on a topic that, honestly, feels like sheer magic to the untrained eye. We're talking about clinical triage. Have you ever watched a medical show or been in a crowded hospital ward and wondered how on earth nurses decide exactly who to help first? It can look like total madness, but I promise you, there's a highly structured, logic-driven framework behind every single move they make. By the time we wrap up this explainer, we're going to completely demystify that chaotic environment, breaking patient care down into a simple, step-by-step system that will absolutely change how you view medical decision-making.
So here's our game plan for today. We'll start with the scenario sandwich, then cover the ABCs or prioritization, followed by acute, chronic, and stability. After that, we'll look at how vital signs tell a story, break down the rules of delegation, and finally, put it all together with the final triage test. All right, let's jump right into part one, the scenario sandwich. We're going to step directly into the high-pressure shoes of a healthcare worker on a busy floor. You ready?
Picture this scenario. You've got 4 patients hitting their call lights at the exact same time. One patient is telling you they're absolutely starving. Another is begging for their pain medication. A third desperately needs help getting to the bathroom. And the fourth patient? They're short of breath, struggling so much they can literally only speak in one-word sentences. Just think about that for a second. Who are you walking to first? Well, if you guess the patient who is short of breath, you hit the nail on the head. Look, the patient who's hungry matters, the patient in pain matters, and the bathroom definitely matters. But the patients struggling to breathe, they always come first. Why? Because in the nursing world, shortness of breath is never, ever ignored. It could be worsening pneumonia, a massive asthma attack, or even heart failure. In this framework, oxygen is life.
Which brings us right to part two, the ABCs of prioritization. To solve these high-stakes clinical puzzles, you really need a decoder ring.
And that decoder ring is the foundation of all clinical prioritization, the ABCs. First up is airway. You have to ask, is it blocked? Because if the airway is blocked, oxygen can't get into the body and literally nothing else matters. Second is breathing. The patient needs to actually move that oxygen down into their lungs and push the carbon dioxide out. And third is circulation. The heart and blood vessels have to be able to carry that newly oxygenated blood to the brain and all the vital organs. You always move in this exact hierarchy. A blocked airway is going to take precedence over a circulation issue every single time.
Now, once you've secured those ABCs, your immediate next thought has to be safety. A good nurse doesn't just react to problems as they pop up, they're constantly thinking ahead, asking themselves, okay, what's the biggest risk right now? Or what could go wrong next? Preventing harm before it even happens is the whole essence of nursing judgment. So, if you've got a confused patient trying to climb out of a hospital bed right after surgery, or someone having a seizure who isn't protected from injury, that becomes your immediate safety priority. Moving on to part 3, acute, chronic, and stability. Now that we have the ABCs and safety locked in, we need to talk about how nurses actually categorize conditions to avoid just helping whoever happens to be yelling the loudest.
So it's absolutely crucial to understand the difference between acute and chronic. Acute means something is brand new, sudden, or rapidly worsening. Chronic means the condition has been present for a long time. Let's contrast the two. A patient with chronic back pain definitely needs care, for sure. But a patient with sudden chest pain, sweating, and shortness of breath, that's an acute, life-threatening situation that demands immediate intervention. Same thing goes for blood pressure. A patient who's had high blood pressure for years is important to monitor, but a patient whose blood pressure suddenly drops dangerously low right after surgery, that is an acute emergency.
Now let's take that acute versus chronic idea a step further into stable versus unstable. A stable patient has expected symptoms that aren't rapidly changing. An unstable patient, on the other hand, is showing new or unexpected symptoms. Think about a patient with COPD. They might normally just sit at an oxygen saturation around 90%. If that's their baseline, they're technically stable. But if a patient who normally sits at 98% suddenly drops down to 86%, they have crossed over into dangerous, unstable territory. That sudden change in condition is one of the biggest, brightest red flags that a patient needs to be assessed right now.
All right, part 4, vital signs tell a story. It's time to reveal the real way healthcare workers actually look at the data on those glowing monitors.
I really want you to let this concept sink in for a moment. Vital signs are not just numbers. Vital signs tell a story. Nurses don't just memorize a list of normal ranges, they connect the number to the patient's actual physical condition. A heart rate of 130 isn't just a high stat on a screen, it's a loud, screaming story that could mean the patient is in severe pain, suffering from extreme anxiety, bleeding internally, battling an infection, or even going into shock. A respiratory rate of 30 means a patient is physically struggling, working incredibly hard just to pull air into their lungs. You are literally reading a story of their physiological survival.
And that brings us to the ultimate red flags, the critical warning signs you need to be hunting for when deciding who needs help the fastest. You're looking for words like sudden, new onset, difficulty breathing, chest pain, unresponsive, or bleeding. But I really want to highlight one that gets misunderstood all the time: confused. If you have an elderly patient who suddenly becomes confused, do not just write it off as aging or dementia. In older adults, sudden confusion is a massive, blaring siren for a new infection, drastically low oxygen levels, or a severe medication reaction. You always have to assess the whole patient.
And speaking of blaring sirens, we have to talk about shock. Shock basically means the body is failing to get enough blood flow and oxygen to the tissues. It usually shows up as low blood pressure, a super fast heart rate, and cool, clammy skin. But pay very close attention to this next point. You need to watch for early restlessness. If a post-op patient suddenly becomes restless and pale, do not ignore it. Restlessness is often the very first sign of poor perfusion and low oxygen. The brain is literally starving for air and sending out major panic signals to the body.
Okay, part 5, the rules of delegation. So we know how to prioritize the patients, but healthcare is 100% a team sport. How do we prioritize who actually does what?
Well, there's a very strict division of responsibilities on a hospital floor. Certified nursing assistants, or CNAs, handle incredibly crucial tasks. They're taking vital signs, bathing, feeding, repositioning patients, and reporting any changes they see. However, the nurses must handle the assessment, nursing judgment, teaching, and evaluation. The golden rule here, and this goes for taking a nursing exam or working on the actual floor, is that you never, ever delegate what requires nursing judgment. If a patient is unstable or they have a new, worsening condition, the nurse has to be the one to assess them first. You simply cannot delegate the evaluation of a deteriorating patient.
Now, I want to clear up a huge misconception right here. Pain is incredibly important. A patient screaming with 10 out of 10 pain after surgery absolutely needs attention, no question. However, in the strict logical hierarchy of triage, pain rarely comes first if someone else's airway or breathing is compromised. But there's one massive exception: chest pain. Because sudden chest pain, especially if it comes with sweating or shortness of breath, isn't just a comfort issue. It's a huge red flag indicating a critical circulation problem, like a heart attack. In that specific case, chest pain rockets right to the very top of the priority list.
And that brings us to part 6, the final triage test. All right, we've covered the entire framework. We know our ABCs, we know acute versus chronic, and we've spotted our red flags. It is time to put your newly acquired critical thinking skills to the ultimate test. So read this scenario carefully. Imagine you're a CNA on a busy floor. You've got one resident asking for a fresh cup of water. Another resident needs help changing their clothes. A third resident is newly confused and trying to climb out of their bed without any assistance. And a fourth is just asking when lunch is going to be served. Think back to the rules we just discussed. Who are you rushing to help first?
Boom! You help the confused resident trying to climb out of bed. Why? Because they are at an immediate risk of falling and severely injuring themselves. This is safety prioritization and action. As a CNA, you spend the most time with the residents, which means you are literally the first line of defense in the safety team. Spotting that immediate fall risk, or noticing if a patient is suddenly weaker or more confused, and reporting it immediately. That is exactly how lives get saved. You can never think, oh, it's not my place. Reporting changes is how you prevent disasters.
So, to summarize, let's tie this whole shebang together into one cohesive mindset. Whenever you find yourself faced with a chaotic scenario, just walk down this exact list. First, check your ABCs: airway, breathing, circulation. Second, secure safety and assess the immediate risk of harm. Third, look for acute, sudden changes versus chronic, expected conditions. And fourth, separate your stable patients from your rapidly deteriorating, unstable ones. Remember, if you're a student or just starting out, you do not need to be a medical encyclopedia on day one. You just need to build this logical foundation so you know the right questions to ask.
Which leads us with this final thought. Nursing and healthcare triage isn't just about memorizing a textbook. It's really about learning how to see the whole patient and thinking critically in the heat of the moment. So now that you're armed with this powerful framework, I have to ask, when the pressure hits and multiple alarms are ringing,
Are you going to get distracted by the loudest voice in the room? Or will you look closely, apply the logic we talked about today, and protect the patient whose life truly depends on you the most? Keep that mindset with you, and I guarantee you'll never look at a hospital room the same way again. Thanks so much for joining this explainer.